Hi, I'm Dr. Charlo, and I wanted to talk to you today about colon cancer. Many of you are familiar with that term, and it's not a nice one to have to talk about, I'm sure. However, I do want you to know a few things about it, and we'll talk about what this is all about. Colon cancer represents the type of cancer that develops in the large bowel. Colon cancer and rectal cancer are put together as colorectal cancer. It combines the two. The incidence of colon cancer is about 100,000 a year. Rectal cancer is about 43,000 a year. So as you can see, it's a fairly common diagnosis. It's the third leading cause of cancer in the United States. And it's the second leading cause of cancer deaths. The symptoms of colon cancer, most people have none. However, there are symptoms that we should be aware of that should cause you to have concerns. For example, if you pass blood in your stool, if you have a change in bowel habits or a change in your stool caliber, abdominal pain, those are things that should cause concern to seek medical attention for. Not necessarily meaning that you have colon cancer, but it does cause concern that should be brought to the attention of your physician. We can detect colon cancer at an early stage today, and fortunately, there are screening tests that can detect polyps that may lead to cancer even before this happens. Let's talk about risk factors, because a lot of people ask, what causes colon cancer? Or why did I get it? Or why did my friend get it? No one really knows the true cause unless there's a genetic predisposition, which is only about 5% of people. But most people develop colon cancer with no predisposing factors that we know of. About 70% of people have none. If you have a family history of colon cancer, your risk is elevated. If you have a history of colon polyps, personal history or family history, your risk is elevated. Those are reasons that you should seek screening tests earlier. However, there are things that you can modify. Your diet, keep a diet low in fats, avoid a lot of red meats, eat reasonably, increase vegetables and fruits in your diet. Smoking has been linked with a higher incidence, and so has obesity. So exercise and eating modestly would probably be beneficial. The screening tests that are out there today for colon cancer include colonoscopies, which are the gold standard. It's the one way you can visualize the lining of the colon and the rectum, and if polyps are seen, they can be removed. If tissue looks at normal, it can be biopsied. If you are not sure about going to a colonoscopy, then there are screening tests other than a colonoscopy, such as Cologuard. You've heard of the poop in the box? Well, it's very reliable, but you have to understand that if it's positive, you need a colonoscopy. Doesn't mean that you have colon cancer, but you may have polyps. It's very reliable. There's also FIT tests, which is a fecal occult test. These tests are available through your physician's office, and they're tests that can be used for screening short of a colonoscopy. But you do have to understand that if these tests are positive, then a colonoscopy is then indicated. Colonoscopies are very safe. What happens if a polyp is found? It's removed. It's sent to the pathologist, and the pathologist will let me know if I do your colonoscopy whether or not it's precancerous or not. If you have colon cancer, it's treatable. And what's important to know, the earlier that it is diagnosed, the more treatable it can be. Colon cancer can be detected by screening methods. It is treatable, and if caught early, it is curable. And with our screening test today, it is preventable. So, Be aware that screening now should begin at age 45 because the incidence of colon cancer is rising as we age. And now we're finding that the younger you are now, your risk may be increasing. So at age 45, that is the time to start screening. Age is still considered the highest risk factor. So as we get older, we should also consider keeping up with our screening tests. We are available for you anytime you're interested in talking more about this. And thank you for listening.